Hi guys, welcome back to this first aid class. My name is Jun Kai. I'm a trainer from St. John Ambulance of Malaysia, state of Penang. Today we'll be learning about wounds and wound management. But before that, let us recap on the last chapter. In the last chapter, we covered the topic wounds and bleeding, which we learned the role and function of heart and of blood circulation in our body, recognizing and managing shock, dealing with moderate to severe bleeding, recognizing and managing internal bleeding, and lastly, managing nose and ear bleeding. With that out of our way, let us start our session for today. Before we get into our topic today, we need to first understand the skin and its function in keeping us safe. The skin is the largest organ in our body, which makes up to 10% of our total body weight. It varies in thickness depending on which body part it is covering. For example, the skin covering the face is mainly softer and more fragile, while the skin covering the sole of our feet is much thicker. The skin is made of 3 layers. The first layer is the epidermis. The outermost layer of our skin provides a waterproof barrier and creates our skin tone. The second layer, the dermis, it is right beneath the epidermis. It contains tough connective tissue, hair follicles, and sweat glands. The third and last layer is the subcutaneous tissue, also known as the hypodermis. It is made of fat and connective tissue. Functions of the skin are vast and varied, but the main functions are to provide us with a waterproof covering, to deter bacterial invasion into our body by providing us with a protective covering. It transmits all types of sensation such as pain, heat, cold, ticklishness, comfort, and pleasure. It also promotes temperature control and regulation through our senses. The skin helps excrete waste products such as sodium and urea through sweating, which was covered in the topic heat exhaustion and sunburn. Lastly, it promotes the production of vitamin D, which is why exposure to sunlight is important to us. This is only a basic introduction to help us understand the role and functions of the skin. It also helps us to understand the need to protect ourselves as outlined in the functions. Before we get into the types of wound, we need to understand the definition of wound. How is a wound defined? Most books will tell you that it is a break in the skin, but it is better defined as an injury causing damage, which may or may not result in a loss of skin integrity, such as open wound, which we are able to see the blood, and closed wound, which is bleeding under the skin caused by internal injury. There are 7 types of wound that we'll be learning in this session. The first is the incised wound. This wound is caused by a clean cut from a sharp-edged object such as razor, broken glass, and knife. Blood vessels are cut across, so bleeding may be profuse. Structures such as nerves or tendons may be damaged. The second is abrasion, also known as graze. This is a superficial wound in which the topmost layer of the skin is scraped off, leaving a raw and tender area. Abrasions are often caused by sliding fall and friction burn. They can contain embedded foreign particles which may cause infection. The third is laceration. Rough forces result in tear or laceration. This wound may bleed less profusely than incised wound, but there is likely to have more tissue damage. The fourth is contusion, also known as bruise. The skin will become blue-black. This is because a blunt blow can rupture the capillaries beneath the skin, causing blood to leak into the tissue. This process results in bruising. Extensive contusion and swelling may indicate deeper damage such as fracture and internal injury. The fifth is punctured wound. An injury such as stepping on a nail or being pricked by a needle will result in a punctured wound. It has a small entry site but a deeper tract of internal damage. Since germs and dirt can be carried far into the body, the risk of infection with this kind of wound is high. The sixth is stab wound. This is a deep incision caused by a sharp or bladed object, usually a knife penetrating the body. Stab wound to the body must always be treated seriously because of the danger of injury to the vital organs and life-threatening internal bleeding. If there is embedded foreign object, do not remove it. Stabilize the object and control bleeding. The seventh is gunshot wound. This type of wound is caused by a bullet or missile being driven into or through the body, causing serious internal injury. The entry wound may be small and neat, but if there is any exit wound, it may be large and ragged due to bullet rotation in the body. But this wound is unlikely to happen in Malaysia. If wounds are not treated properly, it may become infected wound. Any open wound can be contaminated with germs. The germs may come from the source of injury, from the environment, from breath, or from fingers handling the wound. Bleeding may flush some dirt away, while remaining germs may be destroyed by the white blood cells. However, if dirt or dead tissues remain in a wound, infection may spread through the body. Signs and symptoms of infected wound. The casualty might experience increasing pain and soreness at the site of the wound, swelling, redness, and feeling of heat around the injury, pus within or oozing from the wound, swelling and tenderness of glands in the neck, armpit, or groin, faint red trails on the skin that lead to the glands in the armpit, neck, or groin. If infection worsens, there will also be signs of fever, such as sweating, thirst, shivering, or tiredness. Management of infected wound. To prevent further infection, cover the wound with a sterile dressing or large, clean, non-fluffy pad and bandage it in place. Raise and support the injured part with a sling and/or bandage. This helps to reduce the swelling around the injury. Obtain medical advice if necessary. Advise the casualty to seek medical advice. If infection worsens with signs of fever, such as sweating, thirst, shivering, and tiredness, take or send the casualty to hospital. Always adhere strictly to standard infection control principle when handling wounds. Use hand wash, cleansing, non-touch technique, gloves, apron, and goggles. Do not breathe, cough, or sneeze on a wound. Wound healing process will take place if the wound is properly treated. How does a wound heal? Wound healing is a sequence of events that occurs to repair the damaged tissue to its normal or near normal structure and function. Irrespective of the types of wound, the wound healing process of the body remains the same. There are 3 stages in wound healing process. Stage 1. Injury. At the site of injury, platelets in the blood arrive to begin formation of a clot. Other cells are attracted to help with repair. Stage 2. Clotting. A clot is formed by platelets in the blood and blood clotting protein. Tissue-forming cells migrate to the damaged area to start repair. Stage 3. Plugging and scabbing. A plug of fibrous tissue forms within the clot. The plug hardens and forms a scab that eventually drops off when the skin beneath it heals. Before we get into the types and functions of dressing and bandage, we need to learn about wound closure. The aim of wound closure is to restore physical integrity and functions of the affected part without causing an infection and with minimal or no deformity. There is a wide range of dressing products available for use. When choosing a dressing, it must always be larger than the wound to provide proper cover and protect the wound from infection. Types of dressing. There are two main types of dressing. The first is adhesive dressing. It is used for minor wounds, available in different sizes and shapes. It also comes in medicated and plain form. The second is sterile dressing. It consists of dressing pad, gauze or lint, which comes in protective wrapping and sealed. There are various sizes of sterile dressing available, and each sterile dressing have their own expiry date. Once it is expired or if the seal is broken, then it is considered non-sterile anymore. Types of bandage. There are three main types of bandage. First is roller bandage. It is used to secure dressing and support injured limbs. Second is tubular bandage. It is used to hold dressings on fingers or toes or support injured joints. The third is triangular bandage, used as large dressing, as slings to secure dressings or folded to immobilize limbs. Function of dressings and bandages. Dependent on the type and nature of the wound, wound closure may be anything from a simple plaster, gauze, specific types of dressing. Function of wound dressing is to keep the wound safe from further injury or damage, to control bleeding, to prevent contamination and infection, and lastly, providing support and traction. There are a number of different first aid uses for bandages. They can be used to secure dressings, control bleeding, support and immobilize limbs, and reduce swelling in an injured limb. Principles of bandaging. Before using a bandage, there are a few rules we need to know. First, support the injured part of the body while you are working on it. Ask the casualty or helper to assist. Second, work from the front of the casualty and from the injured side where possible. Third, apply bandage firmly but not so tightly that they interfere with circulation to the area beyond the bandage. Fourth, fingers or toes should be left exposed if possible so that you can check the circulation afterwards. Fifth, check the circulation in the area beyond the bandage every 10 minutes once it is secured. If bandage is too tight, unroll the bandage until blood supply returns and reapply it more loosely. Always check circulation, also known as capillary refill, after bandaging. Press one of the nails or the skin beyond the bandage for 5 seconds until it turns pale. Then release the pressure. If the color does not return within 2 seconds, then the bandage is too tight. If the bandage is too tight, casualty may feel a tingling sensation. At this time, you need to quickly loosen the tight bandage by unrolling enough turns for the skin warmth and color to return. Do remember to check circulation every 10 minutes before the ambulance arrives or when you send the casualty to hospital.
To apply a dressing on wound, first we need to apply direct pressure and elevate the injured area. Okay, let me hold your arm. Thank you. Next, we need to clean and dry the skin around the wound. Then, apply dressing directly on the wound. Never touch the area of the dressing that will be in contact with the wound. Remember, always wear PPE for treating a wound. First, we need to apply direct pressure and elevate the injured area. Sometimes you might need to use a bandage to maintain pressure if bleeding profusely. To apply a rubber bandage, first, you need to make 2 turns below the wound to secure the bandage. Then gently turn the bandage in spiral turn and cover 1/2 of the previous layer. After the wound is completely covered, make another straight turn and tuck in or pin the balance bandage. Check the blood circulation by check the capillary refill. Recheck every 10 minutes. If the circulation delay, you need to loosen the bandage and re-bandage after circulation return.
To treat a wound on hand, you still need to apply direct pressure and elevate the wound. Then, to bandage a hand with a roller bandage, place the bandage on the wrist and wrap 2 straight turns to secure the bandage. Then wrap the bandage across the fingers, make a turn and back to the wrist. Pass the bandage under the wrist and repeat diagonal over the hand across the finger and back again. Keep doing the same way and cover about 2/3 the previous layer. Once you cover the whole hand, make a straight turn and pin the balance bandage. check the blood circulation, squeeze the nail for capillary refill for 5 seconds. When let go, if the color does not come back within 2 seconds, you should loosen the bandage and rebandage after circulation return. Keep checking the blood circulation every 10 minutes. If there are some things embedded into the wound, we shouldn't pull it out, because removing the embedded object from the wound will cause more damage to the wound and further injure the casualty. Our aims are to control bleeding, stabilize the embedded object, and prevent further harm to the casualty. We should use a roll cloth or triangular bandage to build up padding on both sides of the wound, and then apply pressure over the wound without pushing the object further in. To protect the wound from infection, you may also place a piece of gauze over the object. Then carefully bandage over the object and pat without pressing on the object. Check the circulation beyond the bandage every 10 minutes. If the circulation is impaired, loosen the bandage and reapply. Call 999 for emergency help. If the object is a splinter that is not deeply embedded in the wound, and you can clearly see and grasp the end, use sterile tweezers to pull it out in the reverse direction that it went in. Clean and dress the wound if necessary. Remember, do not press directly on the object or try to remove an embedded object. We've come to the end of this chapter. So, in summary, we have learned the skin, which is made up of 3 layers: the epidermis, dermis, and hypodermis. Also, its function in keeping us safe from infection by providing a protective covering to deter bacterial invasion of the body. Different types of wound, for example, incised wound, laceration, abrasion, also known as graze, contusion, also known as bruise, punctured wound, stab wound, and gunshot wound. Infected wound, which is caused by the germs from the source of injury, from the environment, from breath, or from the fingers handling the wound. 3 stages of wound healing process, of our body, which is injury, clotting, plugging, and scabbing. The different types of dressing, which is adhesive or sterile dressing. The different types of bandage, which is roller bandage, tubular bandage, and triangular bandage. The functions of wound dressing, which is to control bleeding and prevent contamination and infection. The principles of bandaging, but most importantly, is to check circulation every 10 minutes after bandaging. If the blood circulation is delayed, then unroll the bandage, then reapply it more loosely. Next, we'll be covering how to manage different types of wound in the next chapter.